You're listening to Girls with Grafts, a burn community podcast created by Phoenix Society for Burn Survivors, a leading nonprofit dedicated to supporting the burn community. In this podcast, we'll talk with burn survivors, share resources to help with supporting and improving burn recovery, and discuss how to prevent burn injuries. Here are your hosts, burn survivors and Phoenix Society's marketing team, Amber Wilcox and Rachel Kudlak.
Hello and welcome to season 4 of Girls with Grafts. I'm so excited to be back and recording another season of the podcast. It's hard to believe that we're already in season 4. So unfortunately today, if you're watching, you already know I am by myself today. I do have a guest, but my lovely co-host Amber Wilcox was unable to join us. But she'll be on the next one. Don't worry, she'll be there. So you'll have to tune into our next podcast to hear back from her. But I'm really excited to be launching, like I said, this next season of the podcast. And what better week to do it than National Burn Awareness Week? So if you're new to the burn community, new to the podcast, or new to Phoenix Society, it is National Burn Awareness Week. It's happening all week long. This week is a window of opportunity for organizations to mobilize burn, fire, and life safety educators to unite in sharing common burn awareness and prevention messages in our community. So National Burn Awareness Week is hosted by the American Burn Association. And this year's theme is to spread awareness for preventing flammable liquid burn injuries. Phoenix Society for Burn Survivors participates in National Burn Awareness Week every single year. We lift up the voices of our burn survivors who have been impacted. We help share the why on, why these prevention messages are so important. And we help build awareness to the lifelong impacts of burn injuries. So we'll talk more about Burn Awareness Week in a little bit, but first, let me introduce today's guest and Phoenix partner. So today's podcast is powered by Allosource. Allosource is one of the largest human tissue providers, honoring tissue donors by creating innovative skin allografts to help burn surgeons heal patients. You can learn more about Allosource and their continuing education hours by visiting our resource marketplace, which is linked below. It's also linked in the show's description if you're listening to this podcast. So be sure to learn more about Allosource. So without further ado, let me introduce today's guest. I know, sorry, you guys, you're going to be hearing a little bit more of my voice today than normal, but I'm really excited to have on the president of the American Burn Association. I mean, what better time than National Burn Awareness Week? So today we have on Dr. Robert Cartotto. He is a plastic surgeon and reconstructive surgeon and burn intensivist at the Ross Tilley Burn Centre in Toronto, Canada. He is a professor at the Temerty Faculty of Medicine Department of Surgery at the University of Toronto. And as I mentioned, he currently serves as the president of the American Burn Association. His research interests span the continuum of burn care, and he has been particularly interested in burn shock resuscitation, lung injury and medical ventilation after burns, surgical techniques and outcomes for burns of the hands and face, and the development of clinical practice guidelines for burn care. Outside of work, he prefers being at his cabin rather than the city, and he is an amateur artist and avid backcountry camper. So, Dr. Cartotto, thank you so much for joining us today.
Oh, you're welcome. It's a huge pleasure to be here. Yes. Really excited to be interviewed by you.
Yeah, no, I'm so glad you could join us. I know I just read your bio, but I'm sure I'm missing some stuff. So if you don't mind just sharing a little bit more about yourself and especially how you got involved in burn care.
Sure. Yeah, I got interested in burns when I was a medical student. A professor gave us a lecture on burns. I thought, this is kind of interesting. So I read a bit about it and realized, I really like this. And so I did this elective in Toronto at the Burn Centre. And I was just so turned on to burn care. And it was the burn care team, honestly. And I've talked about this a few times over the fall. People always ask me how I got interested in burns, and it was the team of caregivers that just inspired me. That such a wonderful group of people with a common passion and desire to do this kind of work. And it just took off from there. And here I am 35 years later, still doing burn care.
That's amazing. Yeah, I mean, so many burn survivors and caregivers too, they talk back about, that burn care team that took care of them in the hospital. And, I feel like we all kind of have that like one nurse or one doctor that really just sticks with you throughout your journey, and you always have a special place for them. So that's an awesome story.
It's funny you say that, because I feel the same way about many of our burn survivors. Like, I mean, obviously I treat a lot of patients, and many just come and go and you never see them again. But there's many that I've formed decades long relationships with. And even when they're finished their treatment, I still stay in touch, and I get emails and sometimes cards, and and it's almost like they become family in a way. So, so it's the survivors as well that really has made the my job so rewarding.
Yeah. Well, and I'm sure too, just keeping up, even if you're not treating a patient or a survivor anymore, but, seeing them out living life to the fullest and enjoying life and thriving after a burn injury is just so rewarding to see.
Yep. Oh, for sure. Yeah.
So that may actually lead me into my next question and maybe your answer, but what do you enjoy most about working with the burn survivor community?
I think what it is the journey they make. And it's taken me years to figure that out. I mean, I knew I liked working with them, but as I work with more and more survivors, I realize that, and I understand better that what they do is they're starting a journey from the time of their injury until, and it may be lifelong, maybe it goes on forever. And when I finally realized that, wow, that's how they conceptualize this, it was really meaningful. It really resonated with me, because I have the privilege of seeing them at all these steps in their journey. And I have patients who had so much difficulty and trouble when they, first emerged from the burn unit and went through all the, difficulties that any burn survivor is aware of. And ever so slowly, they get back to life, and they get back to doing things and sharing things and loving people. And so it's really great to see the progress. So I think that's what it is.
Yeah. That's awesome. So I know your every day probably looks a little bit different for you, but what's like a day in the life in your role with the burn community?
Well, it starts in the burn center. So I work here in Toronto, and so some weeks I just do critical care in the burn unit. So these are when patients are really, really sick and they've just been admitted. So I may spend a week doing that, and then another week will be followed in the operating room, and I'm doing the surgery, like the acute surgery, the grafting, and then sometimes burn reconstruction when people have been discharged and come back for reconstructive work. Most weeks, outpatient clinic, so we're seeing follow-up patients at, as I say, at all stages in their journey. And then I have some weeks where it's downtime and just research. I'll be able to do research or work on ABA commitments, that sort of thing. Yeah, well, that's kind of a typical kind of pattern for me.
Yeah, thanks for sharing that. And I think this is probably kind of stemming a little from COVID too, that we've seen a lot of, I don't know if problems or concerns are the right word, but the healthcare industry has obviously been so impacted, especially since COVID. But what are some of the challenges that you're seeing right now, for whether it's in the burn center or just for burn care professionals to like researchers as a whole?
Yeah, it's a difficult time because we've lost a lot of our nurses. Like the burn nurses are really the backbone of the burn team. They're the heart of the team, and they're the backbone. And with COVID, so many of them left. I mean, it was tough. Like being a nurse during that era was really awful. It was hard, a lot of stress, and a lot of people retired early and left. And so So we lost our core group of nurses. And when I talk to other burn centers in North America, like, it's the same phenomenon. I'm surprised every time I'm talking to somebody in, Southeast US or Western US, that it's the same story. It's like we've lost our nurses. And so this is the biggest challenge right now. And the people that are left, I think, still have a little bit of residual burnout. And it's hard. And it's, how do you fix that? And I have ideas about that, but it's tough. It's a big challenge right now, and so we have to somehow recruit new people into the field and get them excited about burn care, and hopefully they'll stay. It will build. It's just we're at a bit of a low point right now.
Yeah. My sister-in-law is a nurse. She works in an ICU unit. So while she's not treating burns, but she's certainly, I can still tell that there's that burnout there that you mentioned. It doesn't just suddenly get better, and especially when you're working with small teams and less resources, obviously that's going to impact every unit of a hospital, not just the burn center.
Yeah.
So what advice, I guess, would you give, or tips maybe to someone who's just starting out their career in the burn care? Or what would you want them to know too?
You mean starting out as a burn care provider?
Yes.
Yeah. I guess the tip that I think is most important is take every advantage you can of your colleagues around you, in the sense that, like, learn from them, stay connected to them, let them mentor you. Like, the people that are going to keep you in burn care are the colleagues around you. So I really emphasize that. It's really important for people to think about being part of a team, being part of a very special group of caregivers, and really take pride in that work. I think it's very, very difficult care. I think, as everybody knows, if you do burn care, it's tough work. Probably some of the toughest in any medical specialty, I'd argue. And the thing that keeps everybody in is that team approach and staying connected to each other. And that means everybody on the team, whether it's the pharmacist or the psychologist or the rehab therapist, it's all sort of one big family.
Yeah, you bring up a great point too, because, I'm learning in my role too, just so much more about really the behind the scenes of what really happens in the burn unit. I used to think, oh, well, I had my burn surgeon, I had my physical therapist, and I had my nurses. And that is kind of where, obviously I knew there was other roles there, but like you said, the pharmacist, the occupational therapist, there's so many more roles that really go into the continuum of care.
Yeah. And even, it's funny, like even our cleaning staff, like we have a small group of people that only clean the burn unit, and they form connections with the patients. And we have orderlies. We don't call them orderlies anymore, but I'm kind of old school. But we have assistants that help out. They're not nurses, but they're care assistants, and those people form connections with the patients. And it's that group. We consider everybody who works up here part of the team. It's a great group of people. I was inspired to one of the people who inspired me to go into this field was one of our orderlies. He just retired after almost 40 years of practice, and he was one of the very first people I met as a med student. And this guy was so passionate about what he was doing, you couldn't help but be inspired by it. And so, it's important for all these people to recognize that they're really special and important.
So what do you mean when you say orderly? I'm sorry, I don't actually know what you mean.
Yeah, that's a really I'm sorry, it's a really old-fashioned term. I think what now they're called their personal, I don't know, medical, there's some name for them, but an orderly was somebody who wasn't a nurse, but would be involved in a lot of the care of the patient, like moving the patient, lifting the patient during dressing changes, holding limbs up, all the really hard backbone kind of work, while the nurses would do burn dressings. So that it's an old-fashioned term, but they provided care, and they still do. Yeah.
Yes, it seems like they obviously fills such an important role.
Yeah.
Like you said, it's not just one person providing that care. It takes the whole team.
Yep.
Mm-hmm. So switching gears a little bit, when you are working with patients and survivors, what are some of the common questions or concerns that you hear most often?
Well, from a physical side, the big one I think is itch in the donor sites and in the grafted areas. And the second is pain, and it comes in all shapes and forms. And third is the tightness problem, so inability to move properly or to the full extent that you want. So those are the three big ones from a physical side. But psychologically, big ones are anxiety and depression. And maybe third, I guess the difficulty of being out in public when you have obvious scars. And boy, I'm always blown away by the stories I hear that survivors tell me about how they can be out in public and people will say like the darndest things to them, or complete strangers will come up and make a comment or ask a question. So that's a common thing I hear among survivors, that this is really hard, and they get used to it. And we help them, and some of our burn survivors that work in our outpatient clinic help them also with, what can you say? How do you respond to those, and just have sort of strategies. And that's a common thing that's hard, that I hear a lot of.
Yeah. And what we hear a lot too, and I mean, this is kind of obvious, but when survivors are still in the hospital healing, they're so focused on that physical healing component, obviously, but they don't really think about the like emotional and mental side of the healing too. And that often only comes once they do go home and they start getting back out there and in those social situations. So it's definitely, there's multiple parts to the healing journey. It's not just one or the other.
Yeah, it is. And I don't know, I guess as I get further along in my career, I spend more and more time talking about those aspects with survivors than I did earlier in my career, because I think it takes time to learn that. You really have to be around survivors over a long time to really help understand better what they're going through. And I don't have it all worked out yet either, but I think I'm better at it now than I was 20 years ago.
Well, and as a survivor myself, I certainly appreciate that, because there are some times where when you go back to the hospital, you can really tell when your providers want you to live the best life that you can. And no one expects any one person to have all the answers to all of our issues, but just knowing that they want that for you, and it's not just all about the physical healing, but they want you to thrive in all aspects of your life. So, and we're still learning. Everyone's still learning. There's not a one size fits all for everyone either.
Yeah. Well, like you said, it's, and maybe I said this too, it's a journey, right? And that's, I guess, one of the most fascinating things about it all. As I meet more and more survivors, I just understand that better. The other thing that I guess you asked me earlier about one of the things that's most rewarding, but there are some patients years later, and they'll say something like, that injury was actually the best thing that ever happened to me. And when I first heard that, I was floored. How could that be? What do you mean? You can't be real out of that. But they tell you about how it changed their lives, and so they grew. Right? They changed and they grew, and they're happier with themselves. And that's phenomenal when you think about it. Like, if that arose out of a horrible injury, it's really amazing to see that.
I hear that all the time, and I agree with that. I wouldn't change it. Early on, when I'm first going through that healing process, of course I would want to take it back. I don't wish that upon anyone. But when you do get further out, and oftentimes there's so many opportunities that have come up for you. I mean, look, I'm working for Phoenix Society for Burn Survivors now. I probably wouldn't ever have been in this role if I wasn't a burn survivor myself. So it it does come full circle. We hear a lot too, if you get asked like, oh, do you wish your burn injury never happened? And people are like, no, it's like, I'm not, I don't know if glad's the right word, but look at what has happened because of my injury now.
Yeah. Some survivors have gone on and not, well, some have gone on to do really amazing things, and some have just gone on to do things. And that's amazing too, right? I mean, it might be as simple as finding a partner. They do amazing things, and it's always gratifying. So getting back to one of your earlier questions, that's what makes it rewarding for me, is to see the personal growth that takes place in many of the survivors.
Definitely. Awesome. Well, this kind of, again, leads me into some of the other questions I wanted to ask you, but I know we were talking right before we actually started recording that you've recently attended Phoenix World Burn Congress this past fall. So, just tell me a little bit more about your experience as a burn care professional attending that event, and maybe some of what you really enjoyed or the highlights for you.
Yeah, it was such it was the first one I've ever been to. And as I told you earlier before the interview, I wish I had started doing this earlier in my career. But I think, it was just the enthusiasm and sense of camaraderie among all these survivors that I think was really inspiring. They all, well, many of them know each other. It's like, a reunion of sorts in a way. It's like going back to a university or a college reunion. And I think the session that I found most rewarding was an interview with two survivors. And Rebecca Aleli, who's a burn OT at MedStar in DC, conducted the interview. And I told her this was an Oprah quality interview. It was really well done. And one of the survivors had survived a self-inflicted burn injury. And it was really interesting to hear her story, because we see this more and more now, and I never know, what happens after that. You survive it. Like, how do you get through that? How do you get past it? And this person could somehow manage to do that. And so it's a really helpful story for me to know when I talk to other survivors that maybe have had self-inflicted injuries. So I think for me, that was the real highlight that stood out. The sharing circles were great too. How can you not be inspired by those? But that interview was really, I thought, phenomenal.
Yeah, I totally agree. That was one of my favorite sessions from the weekend too. I'm blanking on that survivor's name. I know the other one was Carrie, but I'm blanking on her name. But yeah, I really resonated with her too. Obviously my injury's a lot different from hers, but just hearing her talk about finding that like self-love again, which is so important. And that's something we all struggle with, burn survivor or not. But the way she just kind of talked about coping with that, I feel like could really resonate, like I said, for everyone in that room.
Yes. Yeah, I agree.
Yeah. Well, we were so happy to have you at the conference. And, we always love when the burn care professionals come back, and the nurses, like you said, it's kind of like a family reunion. And it's even more awesome when you could go or see one of the providers that helped you at the event. I know that happens every year, depending on location, of course. But I always love seeing those reunions too with folks.
Yeah. And I don't want to spill the beans or give away too much, but we're going to have some really interesting and I think rewarding sessions at the upcoming American Burn Association meeting involving some burn survivors. I think it's going to be a really exciting part of the program. But I don't want to give it away too soon. We
won't give too much away, but let's switch gears. We can actually talk a little bit more about the American Burn Association, because some of our listeners may know about the organization. Some folks may be hearing it for the first time today. So we can talk a little bit about Burn Awareness Week in a second. But yes, the American Burn Association's annual meeting is coming up in April, and it's in Chicago this year. And Phoenix Society will be there, so I'm really excited about that. But can you just tell our listeners a little bit more about the ABA in general and that annual meeting as well?
Yeah, sure. So the American Burn Association, our mission is to improve the lives of everyone affected by burn care, by burn injury, and so and that means everyone. It could be the family member of a burn survivor, for example. It's a wide-ranging mission, and so we're a volunteer organization. We're a nonprofit organization. We you know. Are interested in all aspects of burn care, from prevention to acute care to recovery, reintegration, burn research. We cover all those areas, and so we have initiatives and strategic priorities in all of those areas. And we have a staff in Chicago of about 18 or 20 people, and they run the organization. But it's really the volunteers. It's the burn care community that forms the committees and does the work of the organization. And we have over 2,000 members. And it's a multidisciplinary organization. So it's physicians, it's nurses, it's rehabilitation therapists, it's psychologists, nutritionists, pharmacists, anybody else you can think of on the burn care team. And that to me is the single biggest value of that organization, is its multidisciplinary nature. And it's a really inspiring, fun meeting to be at every year. I went to my first meeting as a medical student, and again, it was the same thing. I just was astounded by this group of people that really loved what they did, and that inspired me into my career pathway. It was one of the things that did. So yeah, that's a little bit about the ABA, and our annual meeting is a week of education and fun and reunion and connection and community. So it's just a wonderful group of people.
Yeah, I got to attend my first one last year. Actually, I was supposed to go in 2020, but then obviously it was canceled due to COVID. And then I can't remember why I didn't go in between those years, but I was so excited to attend my first one last year. It was so much fun. Plus, at the time, I knew, but not everyone else knew, that that's where we're hosting Phoenix World Burn Congress in 2025. So it was perfect for me because I got to get the lay of the land before our conference goes there. But yeah, it was really rewarding for me to, like I said, kind of meet the burn care professionals. I work obviously with them, but I'm really focused on the burn survivor and the caregivers, excuse me. So it was really great to see and hear more from the burn care professionals. And it's funny too, because like we were talking earlier, some folks had known about Phoenix Society, for example, and been involved in burn care for their entire career. And then I also met so many new burn nurses and burn doctors who that was also their first ABA or second ABA, and they were still learning everything about the organization. So I'm excited to go to Chicago again this year. So if you are attending or if you are interested,
I'll be there.
Yes. Well, we know you'll be there for sure. It's part of your job. But we'll have a link in our show's description for the ABA as well as the annual meeting. So if you have questions or want to learn more, be sure to check those out. So going back a little bit to National Burn Awareness Week. So as I mentioned at the beginning of the episode, it is this week and it's hosted by the American Burn Association. So this year's theme is focused on flammable liquid burns. And when I was even typing this up, I forget all of the flammable liquids that even I have in my house. At first I'm like, oh, like I don't have those, but duh, of course I do. From cooking oil and rubbing alcohol and lighter fluid, those are just a few of the examples that I know I have at my house. So most folks probably have one of those items at their house as well. So all week long, the American Burn Association and Phoenix Society will be sharing information and graphics on social media. So be sure to check out some of the resources, especially from the ABA. But I don't know if you have anything else you want to share on National Burn Awareness Week. I know it's a really important week, for that prevention side of things and really spreading the message and in educating others.
Yeah, well, I think you've said it all. I don't have much to add. It's a really important week in the calendar, and yeah, I'm excited for it too. So I think you gave a really good description of it, actually.
Well, I got that from the ABA's website, so
okay.
I can't take credit for all of it.
All right.
So yeah, if you are looking to find more resources, like I said, check out the ABA and our Facebook channel as well. Prevention is really important because, we obviously all want to support preventing more burn injuries from happening. And I find it even now as a burn survivor that there's still things that I'm not even aware of or that I am lacking, which is sad to me because I'm like, oh my goodness, I'm a burn survivor. I've had a burn injury. How am I not 100% like 10 out of 10 on my prevention measures? So, folks who don't know a burn survivor or know maybe a friend of one, this is really important to help spread that awareness and help educate others on, especially this week for flammable liquids, but in general, all the safety prevention measures that we should all be taking at home, at work, everywhere.
Yeah, it all starts with prevention. So very, very important. Yeah,
definitely.
Good messages there.
Yeah. Well, and I also shared at the beginning, you are the president of ABA. We said that you're going to be at the annual meeting, of course, but how did you first get involved with the ABA? I know you said that you attended your first annual meeting as a med student, but how did you really get connected and involved with the organization?
Slowly and progressively. I joined as I mentioned, as a trainee, and I kept maintaining my membership and got to know people. Made connections and joined committees and just kept getting involved with as many things as I could, and eventually was given some leadership roles on different committees and just kind of worked my way up. And all along, it's about the people in that organization. I just can't say enough. Like I can't imagine my career as a burn surgeon without the ABA. Like it's almost part of my fabric. It's like it's important to me, and it's just part of who I am in a way. And I just can't imagine doing this job without being part of that organization. And so, over the years, just kind of worked my way up, and here I am.
That's amazing. So I don't know all the roles, of being the president of ABA or kind of what all goes into that, but are there any, I guess, like key messages or key initiatives that you're really hoping to achieve in your role?
Yeah, I think, the one that I'm most interested in is building a even stronger bond with the Phoenix Society and the ABA. I think our organizations can give so much to each other. And I would love to see that relationship grow and develop because we're inspired by you. But I've heard that burn survivors are also very, in a way, inspired by their caregivers. And you alluded to that earlier in the interview. And so it's a fantastic symbiotic relationship, and I really want to see that nurtured. So I would say for me, that's kind of the main thing I'm hoping for this year, and I hope it grows. And we're going to have some really, as I mentioned, exciting stuff at the annual meeting to help kind of foster that relationship.
Yeah.
Something I'm definitely interested in.
Yeah, no, I love to hear that because that's exactly what we want as well. I know Amy's and Sandra too, who's right now our interim director of programs. Both of them are helping out with some of the events at the annual meeting, I believe, and they're both really excited. And it's coming up quick. I know it's going to be here before we know it. So it seemed much further away, but
I still have to write my speech.
Well, then you have some work cut out for you.
I know. The deadline's looming.
Yes. Well, that's okay. If the deadline hasn't hit yet, then you're so good. So
I have time.
Definitely. Well, no, that's exciting to hear because, like I said, that's what we want as well. And it is funny how we kind of started this whole interview talking about that connection of what we both get inspired by. So that need for the connection is certainly there.
Yeah.
Aside from the annual meeting and, growing our partnership, is there anything else that you're really excited for this year with ABA, or even in your role as a burn surgeon as well?
Yeah. You mentioned that I'm interested in clinical practice guidelines. So these are guidelines that we work on for burn care providers in different aspects of burn care. So this is something I'm really interested in. And we've been building it, and I've been working on this through my presidency, and I'll be working on it, after I'm finished. So that's something I'm very passionate about and want to see develop. We also recently held a research and advocacy summit. So this was a meeting where we tried to figure out what our main priorities are in burn research and advocating for any element of burn care. It could be provision. It could be, improving the quality of care, any element. So that was a fun exercise, and we're hopefully finishing that process off, and we'll have a bit of a summary of our research and advocacy roadmap. So those are a couple other things.
Yeah, that's really exciting.
Yeah.
Can you tell us a little bit more, and maybe it doesn't have to be related to that initiative with advocacy research, but we often will help, find survivors or caregivers to help take part in research surveys and studies. But can you tell us a little bit more of like what goes in behind the scenes before the study, and then even that process after of, analyzing data? That's easy for me to say, but I know it's so much more in depth than that.
Yeah. Well, studies always start with a question. And that's what drives a study. So and it's funny, people don't always, even people in the medical field don't understand that. And all it takes is a simple question that hasn't been answered before, or has been partially answered. And once you have that question, then you start to think about, well, okay, how could I study this? How could I set up a design of a study that will answer my question for me? And sometimes you can do this. Well, there's many ways to do that. You can look back at data. You can try and look forward at data. You can do actual trials where you compare groups of patients in real time prospectively. Sometimes it means surveys. Sometimes it means doing what we call qualitative research, where we would talk to survivors just like you and get your impressions of things, ask you questions, and that qualitative information can be very, very valuable to a researcher and ultimately the people who read the research. And then after that, you've set up your design. You have to often find money to run a study, and that's always a big challenge. And it's a hard part of the process, but if you stay with it, eventually you'll get funding, and then you conduct your study. Analyze results, write it up.
Sounds easy when you put it like that.
Yeah, well, it is and it isn't. It's as a burn researcher, it's something you enjoy, and so yeah, every step of the process is something you like doing, and it's exciting to conduct a study and get those results in. Like when you've done all the legwork and you start seeing the results come in and analyzing them, and maybe you find what you were thinking you were looking for, maybe you don't.
Yeah.
But it's exciting. Yeah.
For sure. Yeah. So I'm going to give a quick plug, because right now we are running our State of the Survivor survey report. Yeah. So while that's definitely not, a full medical or academic research project, but we are running it. So if you are a survivor and you're listening, please take just a few minutes to fill out that survey. It's completely anonymous. It's also, you don't have to answer any questions. No questions are required. And by submitting it, you have a chance to win a Phoenixboro Burn Congress 2025 registration. So that's also really exciting. But it's funny when you were talking about, looking at the data, because I've been just combing through it a little, and it's funny, like some of the things like, oh, I knew that, like, for example, itch and skin irritation and tightness is a common concern amongst burn survivors. Okay. What we knew is shown in the results, but then there's other things that pop up, and I'm like, oh, I'm surprised to see that this is such a concern, or that we're doing really well in this area, and maybe I didn't think we were. So it is fun to go through and just see the results.
Yeah, I went through the 2022 State of the Survivor report, and I have to tell you, one of the most astounding things I learned was that the number 3, so they listed the top 3 concerns of burn survivors, and number 3, which was pretty close to 2 and 1, was that the burn care provider community needed to be better educated about dealing with survivors. And I was floored by that. I thought, wow, like that's really identifying a really big gap in what we think we do.
Mm-hmm.
And that's why I hope as many burn survivors will complete that survey to give us that information. And that's what that finding is driving one of the events we have planned for the ABA meeting. That single finding about how providers talk to burn patients and burn survivors. We can learn so much. And so I don't want to give away too much, but that's going to be a feature.
Yes. So, well, I'm really excited for that annual meeting. And so see, if you're listening and you were like, I'm not going to take that survey, you can really impact change in our community by just taking a few minutes to complete that survey. It's really important. So I'll have a link to that in our show's description as well. There's a lot to check out today after you're done listening. And we always have other research opportunities going on as well. So if you're someone who maybe is up for doing more research opportunities, be sure to check those out. And they're always ongoing and coming up. So be sure to follow us and stay tuned for more. So well, I know we are coming up here on our time, and I do have 2 final questions. But before we dive into those, is there anything else you want to share about yourself, ABA, anything that you want our listeners to know?
Well, other than that, I'm incredibly honored to be on this podcast. This has been like the best part of my day today, honestly. This is just really enjoyable, and I can't thank you enough for inviting me on this podcast.
Of course.
Yeah.
Thank you. Yeah. And thank you so much. I mean, this is perfect timing with National Burn Awareness Week. And like I said, I know some folks in our community know about the ABA, but there's others who don't. So, this is a really great opportunity to educate what you do, both, in your professional role, but also with ABA as well. So we appreciate you coming on. I'm sure you have such a busy schedule, so I appreciate you finding the time to meet with me and record.
It's been worth it. And absolutely.
Awesome. Well, let's go to our 2 final questions. So
you're making me nervous now. 2 for the end.
There are 2 questions that we always ask each guest on every season. So, but today is the first episode of season 4. So I did change them up a little bit. I swear they're easy. I promise.
Okay.
So the first one is, what is something that you would want caregivers and loved ones of survivors to know?
Caregivers and loved ones of survivors. Okay. Really 2 words: time and patience. I think that's the most important thing that I could tell them, is just give things time and be patient. Easy to say. Yeah. But yeah.
No, that's really good advice. And it's short and sweet. I love it. So our final question today, it is our Phoenix Partner question, which today is sponsored by Allosource, one of the largest human tissue suppliers providing life-saving skin allografts. So the question from them is, what is one thing that always brings a smile to your face, no matter how tough your day has been?
Getting home and seeing my wife and my dog, and my son's moved out of the house now. But that's what brings a smile to my face. Yeah.
I have a feeling dogs are going to be, or like cats or pets in general, are going to be a common answer to that question. Because even when I was reading it, I was like, oh, my dog, of course, like always brings a smile to my face.
Yeah.
Awesome. Well, Dr. Cartotto, thank you so much for joining me today. This has been such a lovely podcast. Like I said earlier, I appreciate you finding the time to record this episode. So again, thank you.
Oh, you're welcome, and thank you for the invitation. I've had fun. This was a really fun interview. So
good. I hope the 2 final questions are easy too. I swear. See.
Thought it was going to be maybe a trick question, like favorite movie or book or something.
Now you're giving me some good ideas to throw in, like a trick question there at the end. So maybe I'll surprise the next guest with one of those. Awesome. Well, thank you so much. And just a final reminder, it is National Burn Awareness Week, so be sure to check out the American Burn Association for resources, tips, advice, and more. So again, thank you, and check us out on the next episode.
Thanks so much for tuning in to this episode of Girls with Grafts. If you are enjoying this content, please feel free to rate, subscribe, and leave a review wherever you listen to your podcasts. This helps others find the show, and we greatly appreciate it. Thanks again for listening, and we'll catch you in the next episode.